Minister of Education Dr. Tunji Alausa has called for the transformation of Nigeria into a hub of medical excellence, emphasizing the urgent need to strengthen the country's healthcare education and infrastructure. Dr. Alausa made the call in Abuja during the inauguration of Implementation and Monitoring Committee for the TETFund Medical Simulation Centers, underscored the critical role of medical stimulation centers in improving patient safety, enhancing the quality of care, and upskilling existing healthcare personnel to meet international standards. The minister, while addressing the newly inaugurated 19-member committee, urged them to carry out their responsibilities with passion and dedication, tasking them with finalizing the roadmap for effective implementation and ensuring compliance with the required standards.
Hospitals will be a larger beneficiary of these simulation centers, as well as the chairman of College of Committee of Provosts, because it's a continuum. You use the simulation centers to train doctors in medical schools, nurses in medical school, dentists, and then also as they go into the clinical settings, you also use to train them to perfect their clinical skills. So they've been carefully, we've added additional members. And I believe from the budget we have today, we're building 5 or 6, 7. We're starting with 8 simulation centers, which is quite good. And now your committee would also have to work on sustainability model.
Executive Secretary of the Tertiary Education Trust Fund, Architect Sonny Etono, described the medical simulation as a cornerstone of modern medical education, widely embraced in developed nations to train both students and practicing professionals. He stressed that medical simulation extends far beyond the use of mannequins or computer-based scenarios, and described it as an innovative pedagogical approach that leverages technology-enhanced environments to replicate real-life clinical experiences, thereby improving training outcomes and patient care.
Universities will greatly benefit from this intervention, as they can use the simulation centers not only for training, but also as hubs for innovation, developing and testing new medical devices, protocols, and training models. This initiative will ultimately transform our institutions into living laboratories for healthcare advancement.